What's up? Back on the road, baby. Listen, I just finished a call with the doctor and he said that would make a great video. Other people need to hear that. So here we are. What do you do when a patient says, I want to see a specialist? I want to see a surgeon. I want to wait till I get my MRI results. Things like that at the beginning of care. And you know, this doctor had a instance where he was fighting for the patient's life. You know, 20 years old, if they went to the surgeon, it would just be the wrong option for them. And everybody kind of knows that, and yet this person said, I want to go see the surgeon after, 3 adjustments or something. And the doctor said something along the lines of, that's not a good idea. What's that going to get you? Etc. And this doctor, while he recognizes that perhaps there was a better way to articulate it, at the end of the day, he was still fighting for her health. And she responded by, kind of as if she was backed into a corner sort of feeling, and just basically said, cancel all my appointments and I'm out. Now, everybody here knows that sometimes we do things that are in the best interest of the patient and they don't necessarily see that. Sometimes patients don't see you fighting for their health, they see something else. And a lot of times it comes down to communication. When somebody feels like they want something else, you need to address that first. Something along the lines of, so if I'm hearing this correctly, you feel that the condition is severe enough that you'd rather wait until you have a surgical consult to see if surgery is in order. Or you'd rather wait until you have the MRI and then see if surgery is in order. Or you'd rather have a referral to another specialist, because somebody says, I want to go to a specialist. I say, you want to go to another specialist? So I'm the spine and nerve specialist. Who do you want to go to? But you want to go to another specialist to have another opinion. I don't think that's a bad idea at all. I like opinions. I don't mind opinions. I don't mind somebody getting an MRI. I'd love to have an MRI of everybody's spine, between you and I. So then I just continue it. So in this case, with this young girl, I'd say, okay, so let's say we decide, let's go see a specialist. We're not going to get an appointment right away. It's going to be a couple months. What would you like to do in the meantime? Would you like to do some conservative care to see if we can get you to the point where we can avoid surgery? Or what do you want to do while you wait? MRI. Okay, we'll wait for an MRI. We know the MRI, you're not going to get it right away. So what do you want to do in the meantime? Knowing that there is a chance that this is going to heal without surgery and without having an MRI, what do you want to do in the meantime? Or, my MRI is next week, 3 weeks from now, a month and a half from now, whatever, they have the date. Okay, so let's say we have the MRI and they say you have a herniated disc. So then what? I mean, your choices are the same as they are today. Choices are conservative care or surgery. Well, I wouldn't have surgery. Okay, well then I don't know 100%, and this is your body, but I don't know 100% if it makes sense to wait a month and a half to get news that puts us back into the exact same situation we are right now. From my standpoint, probably the most logical thing would be something different. But do you want my opinion on this? And ask them, do you want my opinion on this? Yep, I want your opinion on it. Okay, well, my opinion would be there is a good chance that we can avoid surgery here. It's highly unlikely that things can get worse, and highly likely that they can get better before that appointment would ever even get here. And even if we get to the point where we need surgery, even if we get to the point where you still need surgery, you've had a much more comfortable process getting there. So to me, it doesn't make sense to just stop everything. But it's up to you. If somebody's backing into the corner and they ask your opinion on something or whatnot, I just ask them, like, do you and you want to give them you want to say exactly what you're thinking, but you don't want to offend them, right? somebody says, they're like 200 pounds overweight. They're like, my knees are sore all the time. And in my head, in your head, you're thinking, how can you not see the fact that you're 200 pounds, you never exercise, you haven't moved in 20 years, you eat a highly inflammatory diet, and you're sitting here complaining about your knees? You can't say it that way. So whether it's that or the surgery or the MRI, it's a very simple question. Do you want me to give you an unfiltered opinion or a politically correct one? Which one would you prefer? It's really simple. Which one would you prefer? They always say, give it to me straight. And then you can say something like, this is dumb, or I don't agree at all, or whatever the case is. It just gives you the avenue too. So finding ways to communicate, but still fighting for the person in a way that they feel loved, but not pushed into a corner. It is a skill, it is a technique. Work on it, because you're going to come up against instances where you need it. All right, guys, practice that this week, and I promise you, you will have an opportunity to use it. Have an awesome day.